and welcome to the channel. If you are new here, then hi, my name is Brittany and I'm a nurse practitioner. If you are a returning subscriber, then welcome back. I'm so happy to have you here as always. As you may know, I have delivered multiple different nurse practitioner boards reviews. So I've done them here on YouTube, and then I've done multiple with a company named Archer. And this time I've just taken the material again. I'm doing it on my own, delivering part of it here on YouTube, and then the complete review course is on Patreon. So for today's lecture, I'm doing the non-clinical topics for the AANP and the ANCC exam. This is a shortened version on YouTube. To get the complete video and the total audio files, then follow the link in the description box below, and that will take you to my Patreon. Make sure to join the tier titled ANCC and AANP exam prep course. It's about 11 plus hours of lecture divided into systems, lots of study tips, lots of study tricks and visual aids to help you in passing your boards exam. And I will, of course, continue to add on study content for you guys as well. So if you want to join Patreon, go ahead and follow the link in the description. It's $40 for 30-day access to the total review. And then also there is another tier there. It's a $5 tier, and that $5 tier is all about clinical pearls, and I also want to do some case study stuff on there as well. So definitely check it out, but without further delay now, we're just going to get into the content. So let's talk about the non-clinical topics for the nurse practitioner licensing exam. All right, so let's talk about the stages of prevention. So this is an important concept to have understanding of before going into your boards exam, because you will see a question, maybe two, on the stages of prevention. So the purpose of primary prevention. So primary prevention is to prevent a disease from occurring or to remove a risk factor. So for example, immunizations or wearing a bike helmet, these are examples of primary prevention. It's preventing something from occurring in someone that has not experienced either an event or a disease in the past. So primary prevention, think P for prevention. I know that one seems kind of obvious, but stay with me because this will help. But primary prevention, you're preventing some event or a disease from occurring. Secondary prevention, this emphasizes early disease detection. So it's aimed at reducing the impact of disease or reducing the impact of injury. So an example of secondary prevention is the pap smear test. This is because it's used to detect cervical cancer in its subclinical state. So someone that's not experiencing symptoms. And so it's used to detect this before the disease progresses or worsens. Other examples of this would be like getting a mammogram done, having blood pressure measurements taken. And so with secondary prevention, I want you to think of the S, think of screening. So primary prevention, we're preventing. Secondary prevention, we are screening. S for screening. Tertiary prevention, so this aims to reduce the severity of the disease as well as any of its associated complications. So an example of tertiary prevention would be rehabilitation, physical therapy. And so for tertiary prevention, you need to think treatment. This is rehabbing. An event or disease has occurred and now we're treating. All right, so let's talk a little bit about Medicare. So there are some important points that you need to know in regards to Medicare, and we're going to hit on those topics here real quick. So Medicare, this is our country's health insurance program for persons 65 and older. Also, some younger people do qualify if they have either certain disabilities or if they have permanent kidney failure. So the program, it helps with costs, but it doesn't cover all medical expenses, and that includes most long-term care as well. And there are different types of Medicare coverage, and we will talk about the different types. So there's type A. So with type A, remember the word automatic and admitted. Automatic and admitted with type A. And this is because it's automatic at 65 years of age, that type A Medicare, in patients that were employed and paid their premiums. So this form of Medicare, it covers inpatient and hospital coverage, so patients that are admitted, and it also covers individuals that have end-stage renal disease at any age. So with type A, though, think automatic and admitted. Medicare Part B. So this is a voluntary program. It has monthly premiums that provides outpatient medical coverage. And so I remembered Medicare B with thinking of the phrase B for broke out of the hospital, because Part B, it covers outpatient treatment, so broke out of the hospital. So expenses such as durable medical equipment, lab tests, x-rays, some very select prescription drugs are included in Medicare Part B. So Medicare Part C, this is also referred to as Advantage, and I remember Medicare Part C with the word choice plan. And this is because it's provided by private health insurance companies that are approved by Medicare. It covers inpatient treatment, outpatient treatment, some prescription drugs, and additional services like vision and dental, which are not included in other plans. And then finally, Medicare D. So with Medicare D, remember the word drugs. Medicare D for drugs. So this form of Medicare provides prescription drug coverage. Most plans have their own list of what drugs are specifically covered, and it's referred to as a formulary. If a non-formulary drug is prescribed, that patient will likely have to pay out of pocket. And then finally, there at the bottom of the slide, you can see services that are not covered by Medicare. So, for example, alternative medicine, most healthcare outside of the US, cosmetic surgery, most dental and vision care, remember, unless you have Medicare C or Choice Medicare, which does include dental and vision. Also, hearing, custodial care, long-term nursing home care, non-medical services, most non-emergency transportation, and certain preventative services as well. So there's a long list of stuff that's not included on Medicare, and you can see that it really depends on which plan they are enrolled in.